breast implant illness affects about 30% of females that get breast implants. And this includes both the silicone envelope, silicone gel filled implants, but also the silicone envelope saline filled implants. Now, the numbers are really important here. It's astonishing. There's about, in the United States, 100,000 silicone breast implants done per year for breast reconstruction after, for example, breast cancer surgery. But elective breast augmentation surgery is done to 300,000 people annually in the United States. And this leads to a theoretical 100,000 elective surgeries that transition patients from presumably being healthy to contracting breast implant illness. Now, very important concept is we always thought that silicones were inert in the body, but unfortunately they're not, and they're very strongly associated with various levels of interfering with cell and bodily function that leads to the development of disease. What are the symptoms of breast implant illness? Other than localized pain, tenderness, redness, swelling, discharge, the systemic symptoms look very similar to conditions like chronic fatigue syndrome, fibromyalgia, Lyme disease, mold illness, early stage neurodegenerative conditions, autoimmune disease. Fatigue is almost a universally observed symptom in patients with breast implant illness, but also very commonly you have brain fog, joint and muscle pain, insomnia, sleep disturbance, memory loss, autoimmune conditions that's got various different names to it, very commonly dry eye, dry mouth, and also visual disturbances. Symptoms can start very soon after implantation, but are most often observed in the first 1 or 2 years after the placing of the silicone breast implants. And then usually there's less incidence for a handful of years. And then typically at about year 7 to 10, as the actual implant material degradation with presumed greater release of not just the silicones, but the other chemicals in the envelope and also in the bag gets released into the body, there is again a greater surge of new symptoms that leads to the development of breast implant illness. Now, really important here, the implant materials are approved by the FDA for up to 7 to 10 years, but unfortunately, most patients that received silicone breast implants aren't told that it has a lifespan of maximum 10 years before you're really obligated to remove them because of materials degradation. The release of chemicals from the silicone envelope and also the saline bag or the silicone contents of the envelope causes several different types of dysfunction. Most commonly, we observe immune system dysregulation, typically with very significant inflammation and pain. We notice hormonal or endocrine disruption, and oftentimes this leads to a multi-body system involved, very complex condition. The causes of these various dysfunctions, including immune system dysregulation with inflammation, and also hormonal system dysregulation, is as a consequence of the silicones migrating through the body. And though not as volatile as mercury or cadmium, for example, they do cause chemical interference, but also mechanically they occupy space, and thus they block hormone receptors. They interfere with cell membrane function, with mitochondrial function, and we've even had cases where silicones were found obstructing DNA gene regions in some of our patients with breast implant illness, blocking your ability to access the DNA that holds the code for not just how to stay healthy and operate yourself, but how to get healthy. So the silicones that started the problem also blocks the way to healing. Chronic infections of the implant capsule are also really important. It does seem to be reasonably common, and various microbes are involved in this. As a consequence of the systemic strain from the burden of the implant materials, the chronic inflammation around the capsule, the scars, it leads to a distraction of the immune system, and therefore we do very frequently see a reactivation of other infections. When you do the lab investigation, you often see that patients with breast implant illness also have reactivated Lyme disease, Bartonella, strep, mono, very often yeast or candida. Biofilm bacterial and mixed bacterial fungal colonies are also a very significant component around the capsule, which can be the staging point for chronic infections that migrate throughout the body. The scar tissue capsule, not only around the implant, but also at the surgical sites. For some people that poses a problem. Sometimes it's a source of pain, but also a source of dysregulating the body in its attempt to regulate and stay on top of its priorities. The implant materials, scar capsules, biofilm communities with various microbial colonies leads to the development of immune intolerance and also overloading of the detoxification system. And because of this, we often see environmental and chemical intolerances in people with breast implant illness, which readily resolve if you follow the correct steps in undoing and remediating the multiplicity of the run-up towards developing this. ASIA syndrome, ASIA syndrome, develops as a consequence of silicone materials leaching out of the implant material and having a negative interaction with the immune system, leading to an autoimmune type presentation with fatigue, pain, and the development of lupus or Sjogren's or mixed connective tissue illness. And then the implant materials, the stress from it all, the pain, the microbial infections either acquired through the implant, the toxicity does lead to the development of a survival response called the cell danger response. And when the cell danger response is fully invested in by the body, in order to have you survive perceived very dangerous and toxic circumstances, it's very hard to exit unless you follow a very specific step-by-step undoing of the signaling that leads to the body engaging in the cell danger response, but also in the maintenance of this survival strategy. And this is essential for you to get better, in other words, to exit the cell danger response and to overcome the breast implant illness. I'm going to share with you a symptom list from the FDA that is, how do you know if you've got breast implant illness if you're feeling unwell and your medical team has told you you've got chronic fatigue, fibromyalgia, Lyme disease, or similar condition. Please look at this list of symptoms from the FDA that are confirmed to be present in people with breast implant illness. Also, I'll share with you some symptom lists and checklists as well to help you differentiate the symptoms of breast implant illness, silicone toxicity, Lyme disease and related tick-borne infections, and mold illness. The symptoms are so very alike, it's even for practitioners very, very difficult to distinguish the difference between these conditions from symptoms only, and therefore a really thorough laboratory and molecular study of the body, of the cells, and most importantly, the contents of your cells are very important. For most of our breast implant illness that we did this very thorough workup, we found not only the excessive presence of various silicone species inside the cells, contributing to cellular dysfunction, but also as a consequence of the stress that the cells are under, reactivated infections, numerous other classes of chemicals that are present in the cell as a consequence of the cells not having the budget to be able to eliminate and get rid of the silicones and other toxins. If you think that you may have breast implant illness either with or after having removed the implants, do reach out to us so that we can assist you in the timeline screening, symptomatic evaluation, and most importantly, the varied laboratory investigations that are exceedingly helpful in getting clarity of the obstacles and the burdens that your body faces in order to get better.